Welcome to It's All in Your Head with Dr. Paul Swingle. I'm your host, Peter Shad, and today we are going to talk about something that affects many of us. In fact, have you felt in the last few weeks with the days getting shorter and the nights getting longer and the feeling of gloom? Maybe it's just a mild case of the blues. Perhaps it's seasonal depression. Maybe it's something more. And today on It's All in Your Head, we're going to talk about depression and mood disorders. Joining me is Dr. Paul Swingle. Pleasure to see you again, sir.
Good to be here.
I should tell you a little bit about Dr. Paul Swingle before we move on. Professor of psychology at the University of Ottawa from 1972 to 1997 prior to moving to Vancouver. He's a fellow of the Canadian Psychological Association. Dr. Swingle was a lecturer in psychiatry at Harvard Medical School from 91 to 98, and during the same time period was associate attending psychologist at McLean Hospital in Boston, where he also was head of the clinical psychophysiology service. Did I say that right? I have a tough time with all those PSs. The Dr. Swingle, also chairman of the Faculty of Child Psychology at the University of Ottawa from 72 to 77, and clinical supervisor from 87 to 97. I'm not only a host, I'm also a client of the Neurotherapy and Biofeedback program. I had some issues with insomnia. I'm into my fourth treatment now, and I can tell you that it's really helped me sleep a lot. I noticed it right after the first visit. And it's interesting because depression was an issue that came up in my last visit. As I was going through with the technician, I mentioned, this last time, all of a sudden, after this last treatment, I really felt the blues come on. And she said, that's a sign that we're making progress. Perhaps you can explain that a little bit.
Yes, very often when we correct one form of depression, there are some emotional negative thoughts and memories associated with that are uncovered. You probably had a few dreams that night or the night after that in which they were psychologically intriguing kinds of things, and you processed it yourself, and 24 or 48 hours later you were better off and felt in a good frame of mind. It's the most efficient psychotherapy on the planet. You do it yourself, and we just facilitate the brain's natural psychotherapeutic processes, which a lot of it is sleep.
We should really explain what it is you do, because I don't think a lot of people understand what neurotherapy is, biofeedback. And it starts with a visit to you, and we'll give your office address and phone number. Here's the number, by the way. It's quite easy to remember. It's 608-0444. And Dr. Swingle, by the way, is downtown in Cole Harbour on Melville Street. And it's easy to remember, easy to find. So when people first come and see you, you do what is called brain mapping. Explain what that is.
Basically, what we're looking at are the brain waves. The brain produces electricity when it's processing information, and we have some standards in terms of what brain activity should look like. So we do an assessment of your brain, eyes open, eyes closed, when you're reading and so forth. And then we have a look to see if there are any areas of inefficiency in the way the brain's processing information. We then sit down with the client and tell the client why they've come to see us. You went through that, so you know what that process is. And we can identify one of many forms of depression the person might have, attention problems, memory problems, sleep problems, alcohol problems, and so forth and so on. They're all associated with some inefficiency in various regions in the brain. Once we've identified it, then the process of correcting those or normalizing brain function is referred to as neurotherapy. There are three general classes of neurotherapy. The first is neurofeedback. We set it up so that when the brain is doing what we want it to do, you'll hear a tone or see something move on the computer screen, and it's telling you about an activity you couldn't possibly feel, but you make use of that information to learn how to self-regulate brain activity. If you're a child, we set it up so that you're playing a video game with your brain, or I have electric trains and the child can make the train stop and go with his brain and so forth and so on. I play with the trains more than the kids do, by the way. The second class of treatments are the brain drivers. My clinic is one of the few in North America that are involved in the development of these more effective treatments. We set it up so that we measure a particular aspect of brain functioning. Based on that measurement, we stimulate with light, sound. With adults, we might use microamperage stimulation, electromagnetic fields, and so forth to nudge the brain into more normative functioning. Third class of treatments are essentially home-based, things like harmonic sounds. That device that I gave you, that you self-administer cranial stimulation, that incidentally is an FDA-approved registered device in the United States, at least. The goal of what we do is to normalize brain functioning, and the good news is once it's fixed, it's fixed.
I could tell our listener here that it's completely painless, and it's very relaxing, actually. In the first treatment I had, we used a little bit of light therapy and sound therapy, so I'd put the sunglasses on that had the strobe lights on the inside, close your eyes, and the only way I can describe it is it's like you're lying back and looking up at a tree that is having the sunlight going through it. And it's very relaxing, and then the harmonics are also very relaxing. In fact, the technician had to wake me up a few times because I had dozed off, which isn't helping the treatment that much. We're talking specifically about it's all in your head, and today, depression and mood disorders. And I guess the first thing I need to ask you is, what exactly is depression? Because it seems to be a new phenomenon. Well, maybe it's not a new phenomenon. It's just maybe people are diagnosing it more these days.
Depression covers a lot of different conditions. The real power of neurotherapy is the ability to identify what form of depression we're dealing with. Some folks experience fatigue, lack of interest, poor sleep, no sadness. It's a burnout form of depression. They're just worn out. Another form of depression is hopelessness and sadness. Another form of depression, there's an agitation variable associated with it. People feel sickish in the upper region of their chest. They feel like they're coming apart at the seams. Then, of course, there are the reactive depressions. You lose a loved one. You go into grieving. There are many, many different forms of depression, and the brain assessment allows us to determine what form of depression you're experiencing, and more importantly, where you go to fix it. It's not one of these shotgun kind of things, take 2 of these a day and call me in 2 weeks. It just doesn't work that way. The hit rate for medication in depression is very poor, despite all of the hype. 80% of the effectiveness of an antidepressant is placebo, and that's data that has been put out by the national health boards in the United States. The real power of neurotherapy is you correct it. Speaking of grief, for example, the one thing you don't want to do is you don't want to medicate grief. What you want to do is process it and deal with it. There are ways that we can help the person during that process, but you don't want to block out the emotion. You'll just never deal with it.
Mm-hmm. And what will happen in normal medical situations, you go to your doctor, you say, I don't really feel very well. They'll say you're depressed, and here, take 2 of these. And then from what I understand and what I've spoken to a lot of people about is that you end up just feeling nothing. You feel numb after a while after taking medication. What is serotonin? Is it just a matter of not enough serotonin going where it's supposed to go?
It depends on the type of depression you're dealing with. The neurotransmitters, of course, are involved in all neural processing. If we are dealing with a situation which is a severe